Hey folks! So last week in our interprofessional education course, we watched a video on interprofessional collaboration between the medical and dental worlds in the care of a diabetic patient. I thought it would be interesting this week to do a kind of reaction-style debriefing where we watch the video together and I comment on the video based on my own experiences as a former nurse, educator, researcher, and also answer some of the questions and comments that I saw on our discussion board. For example, a pretty common comment that I saw on the discussion board from nursing specifically was questions about how representative this was of nursing within a primary care setting, as the majority of the nursing learners in my class are from acute care settings. I used to work in a family practice years ago, so I can provide some insights there. And I am going to edit this video down a little bit, so anyone who wants to watch the entire video that I'm commenting on, I will link it down below in the description.
Hey guys, you ready to order? You need a few minutes.
Yeah, I am, but give us a couple minutes so he can
Take your
too.
time. I'll be back.
Thank you. Why do you have that?
I found out I have diabetes.
Oh, man. You know, my mom has that. But she's not very good at checking her blood sugar. How did you find out?
All right, so Carter and Manny are out for breakfast together, and as they were just getting ready to order, Carter checks his blood glucose levels. Manny asks him what it is, explains he has diabetes, and then Manny asks Carter how he found out.
Actually, it was kind of odd. I was at the dentist.
The dentist?
Yeah.
I would highly suggest Toyota, though.
Well, good. I mean, I'm ready.
Don't go with any other brand.
Okay.
You could, but it wouldn't be that great.
So medical office assistants are absolutely part of the interprofessional team. When I was working in primary care, they were wonderful in terms of helping us with certain things that maybe we wouldn't have as much time to assess or the opportunity. So for example, a lot of times our patients would be waiting in the waiting room for up like an hour sometimes, so they'd have a lot of time to observe the patients while they were sitting in the waiting area. They would also have opportunities to observe their gait. So for example, if someone was coming in and we were assessing them as to whether or not we should allow them to renew their driver's license, they could give us some insight into how they were walking, if they appeared to be under the influence, things like that.
Mr. Montgomery, how are you?
Hey, I'm good. How about you?
I'm good. I'm great. You ready to come on back?
Sure.
We'll get you started so we can get you back to work.
All right, Paula.
Welcome. It was nice talking to you.
You too. I'll check it out.
All right. Now go get your teeth cleaned.
All right.
So your blood pressure was a little high.
I've gained a little weight recently. That's probably it.
Okay. Well, let's start with an...
So some of you were wondering if a dental hygienist checking someone's blood pressure was part of their scope of practice. And luckily for everyone in the class, we do happen to have a dental hygienist in our class. So I reached out to Zelda and asked her if this was something that was within a normal dental hygienist scope of practice. She got back to me and said that, of course, because much like, say, nursing and medicine, they have provincial regulatory bodies. She can only speak for her own province, but she said in her province and in their schooling, they are taught to provide a thorough medical assessment consisting of a risk assessment for overall health. And you're going to see the dental hygienist here go through that in a moment. And she explained that this is due to the fact that our mouths are the gateway to the rest of the body, and infections can be absorbed through the bloodstream, such as gingivitis, periodontitis, as the hygienist in the video is going to briefly explain. And she did explicitly say here also that assessing blood pressures should be done on all patients, particularly for those who are at risk for heart conditions.
An update on your medical history. When was the last time you saw your physician?
I think about 2 years ago.
Wow, that's quite a while.
So having previously worked in primary care, unfortunately my reaction to that statement would not be, wow, that's been quite a while. This isn't my area of research expertise, but I have seen quite a few conference presentations where they talk about how male patients, particularly within this age demographic, are not great about seeking out primary care services. And I would say that's pretty consistent with my own practice, but I don't know what the actual stats are on this.
I can see here it's been over a year since we last saw you. Are you taking any medication?
No meds.
No? Nothing over the counter or any herbal medication?
Well, I
Good
take
question.
a multivitamin and occasionally an Advil or Tylenol for my joints. I mean, roofing all day really puts a lot of pressure on them. And I haven't exactly, lost weight recently. These extra pounds are starting to wear on me.
So what are you doing to take care of yourself? Are you working out?
I wished. I don't have much free time these days. When I get home from work, I just sit on the couch to relax and then watch TV and head to bed.
Well, as we get older, it does get harder to keep the pounds off. Let me just jot down a few notes and then we'll get started.
So I will say, from observing that whole patient encounter, I would say that while, of course, the dental hygienist's concern is going to be more so centered around the mouth, that's pretty comparable to what the types of questions I would be asking my patients when I was a nurse in a primary care office.
Well, after examining your gums, I noticed they were bleeding and a little swollen. Have you noticed anything different since the last time we saw you?
Well, every time I brush my teeth, I spit out a little blood. I mean, it used to be that it happened just once in a while, but now it's more like every time.
So you are noticing that it's happening more frequently than usual?
Uh-huh.
That concerns me. I think I'll mention it to Dr. Douglas before he comes in to see you. Are you ready to see Mr. Montgomery?
Oh, yeah. How is Carter doing? You know, he put the best new roof on my wife's boss's house.
Mr. Montgomery.
All right, so usually in the hallways, at least in my practice, we wouldn't necessarily talk about roofing and things like that, but sometimes something like if the kids played hockey together or something, this sort of chit-chat might happen.
Montgomery actually missed his visit with us last year, so it's been a while since we've seen him. His medical history hasn't changed. It's been almost 2 years, though, since his last medical exam with his physician. So he's complaining of being tired. He attributes that to work, though, and the additional weight that he's gained. His biggest concern is periodontal health, and bleeding when he brushes. So after examining him, I noticed that there's several areas of inflammation, bleeding when probing, and also loss of attachment since his last visit.
So normally in my practice, I wouldn't have given that detailed of a report, maybe for a situation like this where I had a lot of concern. In the clinic that I worked in, our patients were booked in 10-minute intervals. Sometimes 20 minutes if it was something that needed a bit more time, like a pap smear or counseling. And as those of you who work in primary care, I'm sure are very acutely aware of, a lot of times in family medicine, even though you'll have one patient booked for that 10-minute interval, sometimes the whole family comes in and there can be more than one issue that's brought up in our visit. So maybe they come in because little Johnny has a rash, but now little Stevie is coughing or something too, so you end up having two patients in that time frame for one patient, which is why a lot of times when you go into clinics, you'll see something where they say they want just one concern per visit. So realistically, if I had a patient like this where I had a lot of concerns, I may have a more lengthy conversation with the physician about this. But otherwise, if things are pretty normal, I would just chart my findings for the physician and pop the patient chart on the door, because back in my day, we didn't have electronic medical records.
Interesting. Okay, let me examine him and we'll review the radiographs for further sign of bone loss.
Okay.
Yeah, a lot of times we would follow up too if there was some sort of imaging we had done or lab work.
You were right, Sarah. He definitely has signs of periodontitis.
I wonder if there's something else going on with that. I mean, with the weight gain?
So something that a few of you commented on our discussion board was that you weren't used to this kind of affirmation coming back from the physicians, or in this case, a dentist. I would say this was pretty consistent with my own practice in family medicine, but this could just be a difference between primary care and acute care, so we have a much closer relationship with the physician. Where I was working, it was just the one family physician, myself, and the medical office assistants, so we did have a much tighter relationship like this.
You know, I think his mom and his sister both have diabetes.
You may be onto something there. The fact that he hasn't seen his physician in 2 years is a little disconcerting.
Disconcerting, but unfortunately in my experience, not wholly surprising.
We should advise him to make a follow-up appointment with his physician.
Yes.
Should we also run a blood glucose test while he's here?
I was thinking the same thing.
I'll take care of that.
I love that whole exchange. It's so great from an interprofessional perspective. So something else that also came up in the brace-based discussion was whether or not checking a blood glucose level was within the scope of practice of a dental hygienist. So once again, we have Zelda here to answer this for us. So Zelda said that in her province, at least, they usually only measure glucose levels if it's an uncontrolled diabetic patient, but they do need to review their medical history and glucose levels at all visits. And she also said that these assessments are conducted not only for oral health reasons. For example, diabetic patients have higher chances of gingivitis, delayed healing, cavities, things like that, but also for an assessment of risk factors for things like local anesthetic as well. So in short, in some places, yes, this is within the scope of practice of a dental hygienist. It certainly is where Zelda is from in Canada. I don't want to say what province just for confidentiality reasons. And I would assume that it is also within the scope of practice of hygienists in Texas, which is where this video was filmed.
Dr. Douglas, Mr. Montgomery's glucose level is 300 and it's been 2 hours since his last meal.
That's quite high. I'll speak with Carter about our concerns and contact Dr. Jacobs as soon as I can.
Okay.
Dr. Jacobs' office, this is Jennifer.
Oh, hi, Jennifer. This is Mike Douglas at Healthy Smiles.
So I won't play the whole conversation here, but something that some of you asked was, do different offices actually call each other like this? In my experience, we did. I'll talk more about physician-to-physician calls later on. In my experience, we were more likely to receive a fax or something like that. Sometimes the medical office assistants would call each other as well.
Please tell Joseph that we found evidence of severe periodontitis and decided to take a blood glucose test. It read over 300, so I felt Dr. Jacob should follow up with Carter for further definitive diabetes glucose testing.
Sure, I'll note that on his chart for Dr. Jacobs to be aware of.
Also, please note that we're now treating Carter's periodontitis.
Yeah, sure. I'll definitely note that on his chart. I know that there's a definite link between diabetes and periodontal disease, so I will make sure that Dr. Jacobs follows up on that.
It sounds like she has a pretty good understanding of scope of practice and some of the key issues within dentistry and dental hygiene.
And he'll give you a call.
Oh, that's great.
Okay, so we'll be sure to get Carter taken care of. Thank you so much.
All right, bye.
Bye.
Jeez, my dentist barely asks me how my day is going. Sounds like your doctor and dentist talk a lot.
I guess. Yeah, I mean, it's kind of like they should. They're in the same town. They probably play golf at the same place.
They should. They're in the same town. My chiropractor and my doctor actually do talk like this, which makes sense because their practice used to be like 2 blocks away from each other. I think my chiropractor's office, too, used to also do kind of a lunch and learn service at the clinic where my doctor worked, but that was pre-pandemic, so I'm not sure what they're doing now.
So your doctor checked you for diabetes and then told you?
Well, actually...
Oh, and you talked to Dr.
The clinic nurse. This used to be my job.
Douglas at Healthy Smiles about being screened for diabetes, correct?
Yeah, and my hygienist said that there might be a connection between my bleeding gums and diabetes.
Okay. Can you tell me about how much you exercise every week and then also about your eating habits?
Double-barreled questions. This has nothing to do with IPE, but don't ask double-barreled questions like that. So when you're asking kind of the 2 at 1, because a lot of times when you're overloading them with questions, and then they may forget one of the questions that you asked.
As boss, I don't get much exercise on the job. I do work with the guys once in a while, but I don't have any formal program like going to the gym.
What about eating habits?
Yeah, see, she asked 2 questions and he forgot one of them. 1 question at a time.
I just get whatever fits in the glove box in my truck, or I can grab at the drive-thru. I don't have time to stop, much less make something.
And any history of diabetes in your family, close relatives?
Yeah, my mom and my sister.
Okay.
So your mom and sis have it?
So there's a lot more stuff I would have done there previously when I was working as a nurse. Like, where was the physical exam? I would say that my practice and the types of questions I would have asked as a clinic nurse would have been more aligned with the types of questioning that the dental hygienist was doing at the beginning. But we'll forgive them, though, and we'll assume that this was just an editing choice because they then cut the scene. Also, going back here, this is becoming something other than interprofessional education, but when you're interviewing patients or interviewing for research or anything like that, like, sit down, don't stand like that. And this is now turning into a video on how to interview patients. Body language is really important. So standing like this is going to make it feel like the patient is very rushed. And even if you are really rushed, usually in clinics, in my experience at least, there's a place for you to sit. Ideally sit down and face the patient if you can, but I know sometimes now with electronic medical records that can be a bit difficult if you're typing things out on a computer. Try to have very open body language, so don't close up like she's kind of doing there with the chart if possible. And even with the time rush that you can be under and trying to see a lot of patients, like a patient or a whole family every 10 minutes, try to leave a little pause after each question, especially the really important ones. Sometimes patients will have more to add, or they may be hesitating or holding something back. So sometimes what feels like a very long pause to us is actually quite short, and it will get the patients to talk a bit more. Same goes with interviewing for research purposes. Anyways, back to the video.
Yeah, they do. She said that was an important thing to know.
Man, sounds like that nurse asked a lot of questions.
Yeah, she's good. She also told me that there might be a connection between my bleeding gums and diabetes. Then she took my blood test for me.
I really like how in that scene we can see that the interprofessional team really took the time to explain things to Carter, and it sounds like he has a pretty good grasp on what's happening and how to manage his diabetes.
Dr. Jacobs?
Yes.
Carter Montgomery is ready for you in 3.
Okay, I've got time now. When was his last visit with us?
3 years ago.
Huh. Anything new with him?
Yeah, that admittedly is quite a while.
Yes, actually, I spoke with Dr. Douglas on the phone earlier this week.
Yes, Mike, what did he say?
He wanted us to know that they are treating Carter for periodontitis. He wanted to make sure that we knew that. Also, they did a blood glucose test and it ran over 300, which is why they sent him to us. They want us to do definitive testing.
Now, does he have a family history of diabetes?
His mother and his sister both.
All right. Okay. I'll talk to him about all that. Thanks.
Okay, sure.
You say he's in room 3?
Yes, sir.
Thank you.
As I talked about a little bit earlier, I would only do this long of a patient handover in primary care with the physician if I had a lot of concerns about the patient, whether it be something specific that I thought the doctor should investigate, or if I was worried that, say, we may need to send the patient to the emergency room. Otherwise, the chart goes on the door. Because having that long of a handover, unfortunately, while ideal, just isn't feasible when you're seeing patients every 10 minutes. We actually used to have this big clothespin that had the physician's name on it, and I used to move it around on the little plastic things that hold the chart to let them know which room to go into next. And this also allowed me to triage the patients too, so if there's a patient that I needed to spend a little bit more time with, I could take more time and he could just see the next patient. Or if there was a patient that I was really concerned about and there's some sort of emergency, I could let him know he needed to go in there a bit faster, just in case I didn't catch him in the hallway. Oh, and another question that came up here too from some of our learners was comments on how this physician and the nurse seem to know the patient really well, and they were wondering if this is accurate. I can't speak for everybody. I would say in our own practice, I didn't know all of our patients this well. The ones who came in more frequently, we would know a lot better. For example, if someone was pregnant and coming in every few weeks, we would know them quite well, and we would know their history, mostly offhand like this. And sometimes there are patients that say the physician I worked with had delivered like 20 years ago and had provided their primary care for their whole lives, and now they were expecting too. So those ones he usually knew a lot of their histories for. But if it was a patient like this that only came in every 3 years or so, we probably wouldn't know this much unless we went to the charts.
You know, Jennifer, that was a really great pickup on Carter.
Thank you.
Listen, we need to send some labs off, okay? So let's check a fasting blood sugar, a hemoglobin A1C, a creatinine, and a urinalysis, okay?
I would say from my experience, it's a pretty standard interaction, except the physician usually would check off the tests he wanted himself.
And listen, we also need to make sure he's got close follow-up with his dentist so that he can maintain optimal oral hygiene. We don't want him losing any teeth.
Sure.
Right?
Okay, I'll fax him your notes from today.
You know, better yet, let's get Mike on the phone.
Okay.
Maybe I can talk to him about the patient and catch him in between patients.
Sure.
Okay?
Okay.
Thanks.
So something that came up on our discussion board is some people were asking if physicians actually call each other like this. And yeah, they do. Can't speak for every physician, of course, but it's certainly something that happened in our clinic. For example, trying to catch each other on lunch break like this. There's also curbside consultations that they sometimes will do. My area of research is on electronic consultations, so they may say if a physician has a patient that they're not entirely sure of how they want to manage clinically, they have a question, or they're kind of on the fence about whether or not this patient needs to have a referral, they can do an electronic consultation where they can submit a patient-specific question to a specialist, whether it be a medical specialist, like say an orthopedic surgeon, or it could be another professional like a social worker, a pharmacist. In some places, they even have nurse practitioners who can act as specialists on the other end. And they can go back and forth with the specialist and ask the specialist patient-specific questions and get advice on things like what type of blood work should they do, what kind of follow-up, medications. And in a lot of instances, this allows patients to avoid having to have an appointment with a specialist. And if there is a case where the patient needs to see a specialist, at least the specialist can give the primary care provider an idea of some tests and lab work and things they may want to get done ahead of time. And then also in doing my research and interviewing physicians, I've had a lot of them describe to me how they will call up other physicians to ask each other questions. And a lot of times these are collegial relationships that they have formed during medical school and residency.
Turns out I have type 2 diabetes.
And you're so lucky to catch it early.
Yeah, I'm not sure I would have if it weren't for my doc and dentist looking out for me. My doc said I need to, exercise, lose some weight, lay off the carbs and sugars, and I can just take medication to control it. Maybe I won't get complications.
And now Manny is going to describe what this would look like with his care team, which is not a very effective interprofessional or even multi-professional.
You know how that would have gone down if that had been my doctor and dentist?
Doctor, Mr. Delgado is in exam room 2. He's been in there for like 30 minutes, and he's spitting blood when he brushes his teeth.
Well, if he has dental insurance, I recommend he see his dentist. Isn't that what they get paid to do?
Someone woke up on the wrong side of the bed. That is not okay.
Seriously, Manny, you mean to tell me you don't think that your doctor would catch something like diabetes?
Well, I know for a fact that my dentist wouldn't call my doctor, even if I dropped dead in the chair.
Yeah, some of you pointed out that you didn't know if there was a lot of communication between dentists and medical providers. I don't know what the research or the stats are on that. I do know from our practice, we didn't have a whole lot of conversation with the dental community, which in retrospect would have been great because so many of our patients were pregnant, which of course oral health is very important in pregnancy. So in retrospect, it would have been nice actually if we had had some good communication with their dentists and dental hygienists.
All right, 1 second.
It's so gross. I've seen that in surgery too, where I've seen a surgeon like having the nurse hold the phone to his head so he could talk to his plumber while he was doing surgery. Nasty.
Let's get started here. Open wide. Yeah, Ryder. Okay. So, did you catch the football game last night? Yeah? What do you think of that new player? I didn't like him so much. He wasn't really that good. Do you have any nephews? I brought my nephew to the game last night. He didn't really like it. What do you think about that? I mean, boys are supposed to like football. I don't know. Oh, ew, you're bleeding.
Okay, really unprofessional, and I'm sure a dramatization. Surely as a dental hygienist, this is not the first time she has seen bleeding gums. But it's a really great example, though, while a bit dramatized, of how she's not talking to the patient, she's not involving the patient in his care, she's not asking the really important questions that could lead her to wonder, like, hey, I wonder if this patient has diabetes. I love the attitude.
All yours and 2, Doc.
Yeah, I guess I was sometimes guilty of that kind of interaction, where I would just put it on the door, but sometimes things were pretty routine. And I did spend a lot of time talking to the patients. Like, usually I spent 10 minutes with the patients, and then the physician spent 10 minutes with the patients. So, and then anything that was of concern, I would definitely flag down the physician.
Is it Delgado?
Yes. Is he okay?
He's all right. The infection spread too far, though. We had to take his leg. I'm sorry.
I'm sorry.
So that absolutely happens. Anyone who thinks that is a dramatization, no, it's not. A few things I do question there, though, are why are they having this conversation in the hallway like this? At least in all the places I've worked, we usually have separate rooms where we can take patients aside to discuss things like this. And someone in our class, and I'm really sorry, I forget who it was that made this comment, said that it would have been ideal to have someone from a social care profession present for this sort of conversation. A social worker in particular would be someone who you'd want to have involved here because they can help with things such as connecting Manny and his wife to community resources, mental health supports, physical and occupational therapy, things like that. I think they also could have been a lot clearer in their communication here, and that's kind of a thread throughout this whole video. In Carter's care, there's really great communication between all the different professionals and with the patient, and within the second scenario with Manny, very poor communication, both amongst the different professions and then also with Manny and his wife. And then standing there, hands in their pockets, isn't ideal. Great body language. It seems very rushed, and while I understand that there are other patients that they need to see, amputating a limb is pretty life-changing news to receive.
Hey, Manny. You okay?
I hope he's seeing some sort of mental health professional.
No, I'm not okay. I miss being up there with you and the guys. I never would have thought that I would miss 100-degree days on top of that tar paper.
But you're doing great in sales.
It's just not me, man. I don't have the gift for gab, but I appreciate you letting me stay on doing sales.
Of course.
Good friend.
Man, you really need to come to our office. I'm sure they're taking new patients.
Yeah.
Probably not. It is really hard to get a family doctor these days. Unless it's the dentist office he wants in, maybe that's easier to get into. I'm not really sure.
Because I don't want a sales job with you. You give me to your office, and I'll take care of this.
All right.
So when I worked in a medical office, something I would get asked a lot by people was they would ask me to get them into our primary care practice because our family physician had a really great reputation. But our practice was beyond at capacity. It was very full. All right, so thank you for watching this with me. I hope that this helped contextualize some bits of this video, such as what nursing kind of looks like in primary care practice, clarifying some things about scope of practice for dental hygienists. Do let me know if you have any questions, and if you have any questions for dental hygienists, for those of you in our class, at least do reach out to Zelda. I'm sure she'd be more than happy to field your questions. And that's all for now, folks. I will see you all online. Bye.